name is Jess Sherman. For those of you who don't know me, I'm a holistic nutritionist. I work with families and parents who are actively trying to raise resilient kids, mentally, physically strong, healthy kids. A lot of them are dealing with particular struggles, and a lot of them are just really trying to be happy and healthy. And this is the first of many sessions in a series that I'm calling The Resilient Family. It's a series of webinars, and what I really want to do here is offer parents more information, more tools for their toolbox. There are a ton of amazing resources, and now with the online world, you don't necessarily need to be in the same city, so that's great. So the guest that I have today is Dr. Sabrina Berkovich. She is a chiropractor, a doctor of chiropractic, I guess is that, well, I'll get her to explain the terminology, but she is a chiropractor. She works extensively with all kinds of people, young, old, babies, moms, geriatrics, everybody has a particular passion for families and children, being a mom to 3 beautiful children as well. And she works here in Ottawa, but she's going to give you a lot of information about chiropractic in general, and also some things to look for if you don't happen to be in Ottawa. I'm going to actually just turn it over to you, Dr. Sab, and get you to maybe just address the first question that I have, which is what is chiropractic, and maybe a little bit about the training that chiropractors go to. I know a lot of people have safety concerns about, is it something that's safe for babies, for moms in pregnancy and all that. So if you could just give us a little rundown of what it is and how it can be used, that'd be awesome.
So absolutely, Jess. Thank you, first of all, for having me today. I'm honored to be here with you. I will start by addressing what chiropractic is, because I know that out in the mainstream and just out in life, it is a very misunderstood profession. There are a lot of misconceptions about what we do as chiropractors, and I hope to dispel some of those misconceptions and myths today as well. So the first thing I'll say is chiropractic is about connection. And we really strive to optimize the connection between the brain and the body. Because I don't know if a lot of people know this, and I hope maybe this, sheds some light for some people today, but the brain and the body speak to one another every millisecond that you are alive. So the way that happens is through the incredible, intricate, amazing nervous system. And that nervous system comprises the brain, of course. An extension of the brain is the brainstem, and then that eventually tapers down and elongates all the way down a person's spine as the spinal cord. And then there are offshoots that sort of go between all the vertebrae, and those are called spinal nerves. And that is how the body is talking to all the parts, the brain rather, is talking to all the parts every millisecond that we are alive on this earth. So it's really important that as we basically live and experience life through that incredible nervous system, that it is the clearest nervous system that we can have and sort of take care of for the rest of our lives, because we really only get the one. There is no such thing as a nervous system or spinal transplant as far as I know. And so it's really important to take very, very good care of that. As a chiropractor, my job, and I mean, I'll just say this before I go further, but a lot of people think, they think chiropractors, they think neck pain, back pain. And, while we are really great at helping people with physical complaints like that, for sure, it's actually how a lot of people first approach a chiropractor, to be honest, because that is the little bit that they do know about what we do or what we can do. I'm excited to share with you today, the bulk of what we do, where not a lot of people are aware of that. And that is really to maintain this incredible nervous system that we have within us that allows us to function, allows us to heal, allows our muscles to contract, our heart to beat, our lungs to inflate and deflate, our digestive system to function so that we can absorb nutrients from our food. It's limitless. So really that chiropractic really, for me, if I could just, summarize in one more sentence, it's foundational for anybody that possesses a spine, which would be pretty much all vertebrates on the planet. And as far as, so I know Jess had asked as well, you'd asked also, Jess, about our training. So our training is very, very extensive. You know, we don't get, you know, the designation doctor just like that. It's a lot of arduous years of study. Back in the day, so I've been practicing now for almost 17 years, but back when I was a student of chiropractic, you had to have a 3 or 4 year experience in undergraduate life. So not necessarily leading to a degree. I did happen to have a degree in microbiology and immunology before becoming a chiropractor. So that served me well, and I'll get into that a little later. But basically lots of schooling before you can actually get into chiropractic colleges today. So today you do have to have a degree, an undergraduate degree first. Then it's 4 years in an accredited chiropractic college, where the first 2 years are actually exactly the same as medical school. So we are, you know, doing the gross anatomy labs, we're doing the neuroanatomy labs. So, I mean, I've dissected a body, which, you know, graciously, I thank that wonderful donor for allowing me the privilege to learn on her. You know, I've opened up a skull to take a look at the brain and all its intricacies. So it's a lot of study. The last 2 years of our program focus more on chiropractic specific things, such as technique. So there is, I mean, while I've really focused on, you know, that word connection for what we do in chiropractic, there is quite an art to what we do too. And so it is, I find, just personally, as I'm going on in my career, I love this profession. It is evolving as I continue to be in the profession. So it's pretty amazing. I mean, I have a whole bunch of techniques up my sleeve. Jess, you mentioned also, I mean, passionate about family care. I love seeing everybody, but very passionate about children and babies and expectant moms, because that's the key, right? It starts earlier on in life. A lot of things we see later on in life, you know, if I see adult patients or geriatric patients, didn't just start, you know, a week previous or a year previous to when I see them or when they present to our center. It's a process that's been going on pretty much their whole entire lives. And so I love that part, really, you know, seeing these little beautiful children. Some of them are challenged when I see them at first. Some come in for wellness. But all in all, the key is monitoring that amazing system as it's growing and developing, such that we don't have those children turn into adults that have problems or ailments or conditions. They're just always healthy. I mean, I've got 3 beautiful, vibrant children, as you mentioned, Jess. They're pretty much proof in the pudding right there. They're incredibly healthy, incredibly vibrant, and it's not luck. I mean, we do a lot of wonderful things for that to happen with them.
I love, I just want to pick up on something that you said a while back, which was as almost referring to what you're doing as cleaning. It's like making sure that there are clean pathways, making sure that there's good communication. I mean, the central nervous system is like command central, right? So you have to have those clean pathways. It's something that I talk about a lot too, in terms of, you know, the digestive pathways, for example, or just cleaning, or even just cleaning up the diet and just making sure the pathways are clear. And so I love that. It makes a lot of sense. You mentioned that you do work with children, and the people who are going to be watching this really are probably going to be parents. Is there like special training that you do over and above to work with children and babies, or how do you work on them a little differently, or do you work on them a little differently than you do on adults?
That's an amazing question, Jess, because for some adults that we see, some parents that we see, you know, when I propose a checkup for their children, their newborn, you know, if they're an expectant mom and we're already, you know, talking to them about doing something that we love to offer all of our expectant mothers called a well baby checkup. So as soon as they're born, you know, that we assist at births, we attend births. The importance of that is vital, and I'll get into that. But, you know, I get a lot of funny looks, like parents going, really, a chiropractor for a baby? And you're right. You know, your comment just now, Jess, you know, would there be differences, or would there be, you know, special training in handling and caring for this population as opposed to fully grown adults? The answer to that irrevocably is yes, and unequivocally is yes, because they're much smaller and they are very cartilaginous, right? So the spine is not a fully formed osseous sort of structure like it is in humans. I mean, I know we have discs that separate the vertebrae, but for all intents and purposes, babies' spines, children's spines are very soft. So it has to mean modification of a technique. So, I mean, if I could give this analogy, this is usually what I tell my parents, depending on the age, but I'm going to say from about birth to, I'm going to say well into about the second year of life, it would be the equivalent of pressure when you push an elevator button. So imagine what that's like, right? And sustaining those pressures or that contact until correction is achieved. And really with babies, you're not hearing pops or cavitations or anything like that. It's it's a patience game. And it does require a lot of wonderful touch and specialized touch. So to answer the other question you asked, Jess, I just completed in 2014 a 17-month certification for prenatal and pediatric chiropractic care with the International Chiropractic Pediatric Association. It's a mouthful, ICPA. And it was, I loved every second of it. So it was really dedicating a weekend every month for those 17 months where I would be in class with my colleagues, and, you know, different speakers would come and teach us different aspects of caring really properly for children. So we covered conditions, we covered, you know, autism, the spectrum, we covered asthma, allergies, we covered brain injuries due to birth traumas. I mean, it was unbelievable and extremely useful in my life, because it's amazing. I really believe that, you know, once you do this, you're telling the universe, I'm ready to help kids like this. And as soon as I completed, I'd been seeing children all through my career, of course, and I'd been taking little courses here and there. But I mean, after I completed that certification, I am a really busy pediatric prenatal chiropractor since then. And I'm so grateful for that, because I love it. I love learning, and I love serving to the best of my ability to those people. Absolutely. And those children.
That's awesome. That's so awesome. I'm so glad that you did that. It's perfect for you. I'm glad you're just here helping so many families. So I want to hear more about well baby visits, because you know, it's something as a new mom, you're just like, yeah, you go to the doctor and you get their, you know, their weight and their height and whatever they do at a well baby visit and make sure everything's okay. So can you speak to the moms who are just like, really? Like, wow, you could take your newborn to a chiropractor for a well baby visit. What are you looking for, and what do you do, and what can that prevent, I guess? What are you trying to get at there? And from there, I want to go into some of the acute stuff that you deal with too. But first, I want to talk about this whole well baby thing.
Perfect. So I love that question, Jess, because I see a lot of babies, as I mentioned earlier, but just yesterday when I was in the office, I mean, I saw 2 well baby checkups that afternoon, and it brings me joy because now these happen to be referrals from existing patients who said, you know, you have to bring the little one in to see Dr. Sab because she's just going to check them out, make sure they're okay. I mean, because, you know, your question's a wonderful one. It's, you know, what do you do? And why would anyone think that, why would that be on your radar, right? Because you go to the pediatrician for some sort of checkup like that after birth, hopefully. And I'm going to just say this without really, you know, sounding too pompous. It's our examination of a newborn or, you know, a baby in that first year is probably unlike anything you will ever experience, because first of all, it takes about 45 minutes. So it is very detailed, starting with super detailed paperwork about the history of both the pregnancy, so mom's history while she had the baby in utero, as well as prior to getting pregnant. We like to know all of these things, and I'll get to that in a moment as to why. In addition to the birth experience itself. So, you know, most people out there think, oh, natural birth, they just came out the birth canal. Well, there are a lot of factors that influence whether or not something has occurred, especially to the cervical portion or the neck portion of the spine of the newborn, because let's face it, whether it's a vaginal birth or a cesarean section birth, that is how we are coming out of our moms, right through the head and the neck. And so there can be, in a great majority of us actually, some misalignments, or what chiropractors refer to as subluxations. So literally bones that are out of place, slightly misaligned, causing interference on that brain to body connection right from the get-go, right? And then how would you really know that? Would a baby be able to tell you, ow, that hurts? And here's the other thing, it may not actually hurt, but it may be displayed in signs that I would be looking for rather. So for example, the mother that I had in yesterday with her daughter, beautiful little girl. So she's 6 weeks old, and they're already noticing that the baby prefers one breast. So seems to have more ease of feeding off of one breast relative to the other. Okay, so after doing some very intricate neurological tests and detailed, just observation is a really big one here too. I can see and I could palpate and feel that there was restriction at the occiput, or right under the skull on her right side, which was preventing her from really enjoying one breast compared to the other. And so, when I explained that to mom and dad, who was there as well, the light bulbs kind of go off, and they went, oh, wow, okay, now I see why the chiropractor might be useful. I personally think, Jess, we should be in hospitals. Like, we should be right there in the birthing rooms to do that check right away, like right minutes post-birth, maybe an hour post-birth, let the baby be with mom first and skin to skin and all those great things. But I think it's a vital checkup, because we're also detecting, by looking at neurological tests and certain reflexes that should or should not be present, we can tell you, whether or not the brain is on its way to really healthy and normal development. We caught a little girl who, again, was 9 months old. This is a couple months ago. And she just showed some signs that maybe she may be on the spectrum, believe it or not, at 9 months old. Now, most of these diagnoses occur when they're 2+, right? Because that's when they can take directions, commands, that kind of thing for different tests. A 9-month-old baby's not going to be able to take those commands, so then it's going to be, watch and wait sort of thing. But I'm detecting abnormalities in how she's trying to walk, in the fact that she's 9 months old and she doesn't really move. 9-month-old babies move. Jess, you know this too. You're a mom as well, right? So this baby, you could put her down, she doesn't move. When she tries to walk, one of her feet goes on sort of the back of the foot, the dorsum of the foot. That's not normal when we're taking our first steps or trying to. So I told the mother that, and she knew there might be something going on. And sure enough, like I said, I've seen her for a couple of months now. All those things are improving. Neurological tests are coming back normal again. So again, it's really powerful. It's a very vital, powerful examination to have. And it's to make sure there's nothing wrong. It's not, we'll wait till something's wrong and then we'll bring them in to see a health professional. I feel the opposite approach is way, way better and much more proactive in the overall health and well-being of that child.
Yeah, it's again back to that cleaning the slate thing, right? It's like, let's clean the slate so that everything is in place so that they can do what they're programmed to do, which is to grow and to learn and to thrive, which is what exactly we're programmed to do. But if there's blocks in the way there, then they have to find workaround mechanisms, and they have to, and yeah, that's amazing that can happen so young. So is your well baby check just sort of like a one-off thing, or is it a series of appointments?
So the well baby checkup itself, Jess, is, as I mentioned, so it's a very thorough exam that first day, along with, so we also do something called neurological scanning of the baby. So that's just a non-invasive test that reads and detects activity coming out of the nervous system of the individual. So in this case, it would be a baby or a child. And then we would have the parents and the family back for the results. So it's what we call the Relate Your Findings appointment, where we would share what those results actually mean, because I think that's important. I don't think a lot of parents really get exposed to those kinds of visits. It's just like more of a dictation, like, okay, this is what's happening, so take this, right? And sometimes not even this is what's happening, right? It's take this. And so we really pride ourselves on education, because, let's face it, it's a lot better to understand why we're going to do something. I really feel that is very, very important. I appreciate it, and I know that's why we do it with our own patients. And finally, at that visit, we would also give our recommendations for number of adjustments, and that would be the correction of that pattern that we see. Gentle training or retraining of bringing the nervous system back in check and back in tune, and no distortions or interference, so that the body can really experience and express full and optimal health, which is what we're designed to be doing anyway, right? And so at that recommendations visit, I would give them my estimation on how long it would take to resolve said issues if we found any. And if we didn't, usually what I do with a truly well baby, that doesn't happen very often. I hate to say that on the air, but that's true. But if I did see a truly well baby, we have a chart that we give to our parents to show when would be really great times to bring the baby back in for checkups during that first year. And usually it's milestones. So when something, really big happens in their life, they really, learn to hold their head up very confidently, very stably, great time for a checkup. They learn to, start to roll over, be a little bit more mobile, great time for a checkup. They learn to sit, they learn to start standing or cruising, great times for checkups. So in that first year, if this baby is truly well and the nervous system is really clear, it's merely a monitoring sort of series of appointments that we recommend just to be sure that, that development is progressing. Like you said, I know that's going to come up this whole interview, but nice and clean and clear, right? We just want it to progress as it should, because it's interesting when we see children that come in, I've got a little boy that I'm dealing with right now. He's lovely. He's, a tween, so he's 12 years old and has severe autism. And we've made some pretty amazing leaps and bounds with him. But I have to tell you, his parents, when they found out what exactly it is that we do and understand it a lot more deeply, they really wish I had gotten to see him earlier, or some pediatric chiropractor got to see him earlier, because as you can imagine, we've got 12 years of layers that are not exactly right. And so with that, while it isn't impossible to help clear his pattern as well, I really do believe in that because I've seen it and done it. It's a little bit more challenging, certainly you can appreciate this, than if I were to see him, let's say, somewhere in that first year, caught those early signs, and who knows what would have happened after that if we're really addressing those initial, very important foundational first 5 years of layers. There's a reason they say, the first 5 years are really, really critical to development of a child, because they really are. It's really laying down some very important foundation for later on development as they get into their, tween years and adolescent years, and then finally into adulthood. Absolutely, it's crucial.
It's amazing. It's like real, true preventative medicine, right? And imagine where we would be if we actually invested in prevention. So I want to move a little bit to like older children in just a second, but you are in Ottawa, and we're going to make sure that we get contact information for you and stuff for parents. But if people listening to this are not local here, what should they be looking for? Like, can any chiropractor do this sort of well baby thing? You mentioned some extra training that you had, but is there sort of a foundational well baby kind of thing that you could expect from anybody, or should you be looking for specific things in the chiropractor that you take your kids to?
Well, Jess, that's a great question as well. And I have to say, I would still be, I would be asking certain questions upon sort of research, like in researching different clinics, depending on, where I live and that kind of thing. I'd make some phone calls, I'd look at websites, that kind of thing. But I think if I could leave parents and people that are watching today and listening today with, this is a really important tip, but just make sure that, that chiropractor is comfortable, right? Seeing children, obviously, has some experience with that, and has some sort of certification. So, the ICPA, so I'll give you all of that information too, Jess, but the International Chiropractic Pediatric Association has a directory that is online. And so I'd be part of that directory. My colleagues around the world are part of this directory, as long as they've done, some sort of training, they're members with the ICPA, that sort of thing. So that gives a lot of credibility as well, and gives the parents peace of mind that, yes, in fact, this is going to be a chiropractor that's comfortable doing this. And another incredible group that I'm belonging to is called Epic Pediatrics. So this is a community that was started by the incredible Dr. David Jackson and his colleague, Dr. Tony Ebel. And the two of them have, made pediatric chiropractic almost a household name. Like it was not even really talked about until the ICPA, obviously that's basically the organization that started it. And then, really that helped it evolve, I would say would be the Epic Pediatrics people. They're unbelievable. So they also have an online directory. So I would really look up chiropractors in either one of those directories that are comfortable and have experience, in caring for children. Yeah, definitely that would be important to both of those things.
So I'm just going to write those in the chat. It was Epic Pediatrics and the ICPA.
Correct.
Okay. Okay, so far, and people have been trickling on as we're going, so hopefully you can catch the beginning in the replay. And I also didn't mention, but if you would like to ask Dr. Saab a question, you can write it in the chat and I'll read it to her. So if you have a particular question that you want her to answer, that would be great. So far we've really talked about babies mostly, and using chiropractic as sort of a way to prevent problems from occurring, or detecting really, really early subtle problems that don't necessarily haven't manifested in behavior or any kind of real issue yet, but that a chiropractor can really get in there and find some early signs that things might be developing in the wrong direction or might be blocked. And so now I want to talk a little bit for parents who have older kids. Maybe you could talk about some of the more acute things that you can deal with. And like when, let's say, a parent has a kid who has some sort of issue, whether it's sickness or developmental issue or whatever. Maybe they hadn't thought about chiropractic. In what situations do you think chiropractic should be on their radar as a possible tool?
So the simple answer to that question, Jess, is always, because a body that is free of nervous system interference, clear to function and have optimized brain to body connection, is a body that is healthier. There's no question about that. Okay. So I see a lot of, now while we talked about, ailments or possibilities in things that may be developing, that kind of thing, that's still sort of, what if situations, right? And I want to say that even though we don't in chiropractic claim to treat anything, right? So I'm not treating an ear infection, while I will definitely be very effective at helping clear that, okay? I don't treat autism, I don't treat asthma, I don't treat really anything. However, by looking at the spine, looking to Houston control, as you so eloquently put that just a moment ago, I can tell you if there are barriers to Houston control's functioning, then it's going to have a bearing on the health status of that person, that child. So my best way to answer that question, Jess, I'll answer the first part of your question. So, in what acute cases, would we consider or do we see in practice in our center? I mean, anything from frequent colds, okay, like to ear infections, that would be maybe younger populations. Older kids, I'm going to say, now that activities become a little bit more regular, so the hockey and the football, ballet, gymnastics, we'll look at that side, and just life in general. Concussions, unfortunately, we're seeing more and more pediatric adolescent concussions, again, usually due to some sort of trauma from sports, athletics. And we are also, certified in dealing with that as well. So a lot of, if we're talking about concussion, a lot of recommendations from health providers are, just rest and it should be fine. You turn off the TV for a couple of days, you should be great. Well, that's not really true, okay? Because what ends up happening is that's not enough. That's a great recommendation, but it actually should be probably longer than just a couple of days. Supplementation has to happen, right? Like nutrition has to be a little bit different. The way that this child's time is going to be divided is completely different now, in addition to exercises, in addition to obviously chiropractic adjustments, but in addition to exercises specifically designed for the brain in order to allow it to heal in the areas where there have been compromises due to head traumas or non-head traumas, because concussion doesn't have to be impact, right? It can just be like a whiplash. As long as the brain has been jostled, that can lead to a mild concussion. So as far as acute situations, more and more kids too, as we're getting a bit older, or they're getting a bit older, and they're carrying a backpack, at school. And I mean, you probably know this, Jess, as a mom, just from observation. I mean, the backpacks are bigger and heavier than the kids carrying them, right? And that's just generally not a good idea. I think that's probably innate and intuitive for a lot of people watching that. But I got to tell you, I'm seeing more and more young kids coming in to see me, 10, 12 years old, and they're telling me they have low back pain. And that is, it's shocking to me. It's unacceptable to me. Somewhere along the line, we're not really watching how this carriage of the backpack is happening, right? So, I mean, if you come into my house, we don't have any backpacks to carry on your back. So all three of my kids have rolling backpacks. So, they thought it was a little geeky at first, and they thought, oh, mom, we're going to get, I'm like, doesn't matter. You have two parents, not just one, two parents that are chiropractors, and nothing is going to be loading down your spine. Not only that, hampering and haltering growth and possible compressive forces on joints and bones that are trying to grow. I mean, it doesn't even make sense. And I know that the bags are really heavy. We're not respecting that, rule of less than 20%. It's like more than like 40% of their body weight, where it should be less than 15 to 20% of body, right? So that's not being respected. And so there are consequences to that. That adage or that saying, as the twig is bent, so grows the tree, right? We don't want anything like this to happen. And I would say that, you've mentioned this a few times, Jess, but most of what we do is in fact preventative, right? So it's just like, you don't wait until, hopefully people aren't waiting until they're going sort of partially blind in one eye before they go see the eye doctor, right? Or they're not going to the dentist when they have searing tooth. Some people do that, mind you, but hopefully most people are not going when they have searing tooth pain. Now they're thinking, oh, I better go to the dentist. You pass that point, right? So most of this is preventative, right? So especially for those children that, weren't blessed enough to have chiropractic in their life, let's say before their teenage years, you can still catch up. It's really great. An assessment does reveal a whole bunch of things that you may or may not be aware of, probably more that you're not aware of. And then we can just kind of take it from there. So the wonderful thing about what we do, regardless of age, it's awesome when, babies are starting chiropractic care and it's more for prevention, right? That's wonderful. That makes me so happy, makes my heart sing. But it's okay to access our service or to, approach chiropractic care anytime in your life, any condition in your life, any status in your life, because the wonder. Can you still hear me? Can you hear me now? Yes, you can. Sorry, I think I hit the wrong button. Sorry about that. But the wonderful thing is, it's more about what direction you're pointing in, okay, more than sort of where you are right now. That's important too, mind you, but what direction are you pointing in, right? Wellness and vibrance and health and vitality, or sickness and chronic issues and, things that are not really pleasant to have great quality of life. And that can happen at any age. And so what's amazing is I always tell patients this, even when I meet kids, when we meet babies, parents, the golden year population, I always tell people it doesn't matter what it is right now. That's temporary, right? Your body is designed to be thriving and vibrant and healthy. And maybe there are just a few barriers to that happening right now, and we can help you with that, right? So I would say that it's just an amazing preventative, proactive tool, because you know who's responsible for your health? You. and parents in the case of minors. I have to say, it can't be just them because they can't drive themselves to their appointments. But that's really what it comes down to. Like, you get one of these temples, right? So we want to make sure, I love what you do too, Jess. So you want to make sure you're really honoring that temple with the food and the fuel that you're putting in, with really honoring your spine and nervous system to being the best that they can be, so that you really can have that optimal life experience. We don't have to just survive. We're supposed to thrive.
You know what I love about what you're saying, and what, every, I think, single holistic practitioner that I've spoken to, kind of the nature of holistic thinking is that it's always collaborative. It always involves asking parents to really tune in to their children and have a deeper understanding of what they're doing, why they're doing what they're doing, how they're developing. And I think it's instinctual, like for parents to already have that intuition, because parents always, like something is up. but either you feel like a hypochondriac or you're told that, leave it to the professionals. But this kind of way of thinking, the way you're speaking, really honors that understanding of, you know what, if you think that something is up with your kids, take them to get a second opinion of someone who understands that what you're seeing is not stupid. What you're seeing is actually relevant and actually real. I think it's really important, and it's really empowering for parents. The other thing that I wanted to pick up on is, correct me if I'm wrong, but it seems, I always think that things need to be just simple. Like there's so much information out there, right? And the more we can simplify it, the better we are. And chiropractic just seems really simple. It seems like it doesn't matter what the condition is. You're not treating the condition. You're just helping the body work better. Is that kind of accurate by really focusing on the nervous system?
100%, Jess. Like that's very simply put, because simple things are usually the truth, right? So you said it perfectly. All we're doing is removing any barriers to the nervous system's optimal functioning. And because the nervous system controls everything about you, that's only going to make your health status better. Does that sort of make sense? That's a very simple way of putting it. So it's amazing when we meet people, like regardless of age, once again, but we meet people, and I have to tell you that sometimes it makes me sad when I meet someone who, this will be obviously not a child usually, but someone who is, fully grown adult like you and I, but they come in and they're just, they've been told by countless professionals in the mainstream arena, and that's okay because that's just how they're trained, right? That this is it. Like you're just going to have to get used to this. This is life. Just, suck it up, buttercup, and this is it. And I look at them really with truth in my eyes, and I'm like, okay, that's BS. And I highly disagree, and I really beg to differ with that statement, because nothing about you is engraved. You have to invest and invest and invest and constantly tend to this incredible thing that is our body and our health all the days that you will be on this planet. It never ends. So that includes children. So if you want to give, what I usually tell parents, you want to give your kids the greatest gift to an incredible start in life, let's have a look at them. Let's just do a check on them. And then, like you said so beautifully just a second ago, Jess, it is very, very multifaceted what we have to do to really be healthy and well in this life. So, I mean, another thing, just as an aside, that our center has developed, and it's wonderful, I love it, is a program called the Live Well for Life program. And so what that means is our center is called Live Well Family Health Center. So the Live Well for Life program really wants to emphasize the fact that yes, brain-body connection is foundational, is of the utmost importance for a healthy body. There is no arguing that. However, I wish I could adjust McDonald's out of a body. I can't. I wish I could adjust a workout into your body. I can't. So there has to be really great nutrition. You have to look at that as the fuel for this incredible temple that you own. You have to move your body every single day, every day. And this applies to children today more than ever as we become a lot more sedentary. They're becoming a lot more sedentary. The original PlayStation was outside, like, playgrounds and structures that were outdoors, not the video gaming system, which can be fun, right? I'm not saying don't do that. I'm just saying don't do it as much as we are doing it, because there are consequences to that later on that we don't even know what those are yet, right? Dun, 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 stay tuned, right? And then there's, make sure that your thoughts are in check. You get to control that amazing attitude every day. And we want to rear our children that way too, right? We want to have gratitude and we want to have wonderful, positive attitudes. I'm not saying it's going to be, life in rose-colored glasses all the time. However, have a purpose in your life. Know why you're waking up in the morning and what your goal is that day, and visualize the day. And meditation goes a long way even for children, right? And finally, sleep. I mean, that's when we're recovering and restoring and preparing the body, believe it or not, for another day of this thing that we called an extraordinary life. So it's very, very collaborative, as you said, and that's the perfect word. It can't just be one thing. It's got to be all these things, because those are congruent with the requirements of the human body, right? So this applies to everybody. Everybody, no matter the age, no matter the condition. These are things that they're truths about how to be healthy and have a wonderful, vibrant life.
Yeah, it's really back to basics.
Exactly.
Right? Back to basics, to simplify and just cut to the chase. And yeah, can you, do you remember a little while ago you posted that little case on Facebook about the baby? Can you give us that? Because that was something that is like so beyond what you would think of a chiropractor for, and it was amazing. Do you remember? Do you know what I'm talking about?
I do, Jess. I just saw beautiful Olivia yesterday, so yes, she's fresh in my mind. And so the story was this, and I will just say this and preface this for listeners and viewers. Every day, I'm very blessed to witness and be a part of the things that I get to be a part of. So I'm so grateful for what I'm about to share with you, because it just reminds us how powerful the body and the healing ability of the body is, and B, that it can actually do those amazing things as long as there's no interference to that incredible innate intelligence and innate ability. Okay, so parents, they were together at their daughter's initial appointment, brought in their little beauty named Olivia, who is 5.5 months old, into the office because of recurrent ear infections, but a really, really bad one that was the mother thought it was an ear infection and had brought Olivia to the pediatrician, and the pediatrician, surprisingly, because I mean this is actually the opposite of what usually happens, dismissed it as, oh, she's just teething, I wouldn't worry about it, whatever he said. And I'm actually grateful for that, because then there weren't, antibiotics that had to be dispensed. And I'm always happy when that doesn't have to happen. And, once again, the power of being on these pediatric chiropractic directories, Diana, the mother, basically, looked online and searched up pediatric chiropractor, Ottawa, boom, I pop up. So that's wonderful. And they come in and, I just take one look at Olivia, and there's like a crusted, like sort of brown sort of crust on the outside of her ear, just the external part of her ear. And on the inside, it's like the same colored liquid. It looks really kind of gross. I have to be honest. It has a pungent sort of odor too. And as I mentioned earlier, I have a background in microbiology and immunology. Even if you didn't have a degree in what I have, you would know there's something definitely brewing in here. And her eye, the same side eye, so it was the left ear, the left eye is also tearing uncontrollably. It's clearly irritated and probably uncomfortable. She keeps rubbing it. So, those are little signs we can pick up from a 5.5-month-old. She's also tugging at her ear. All the signs were there. And I explained to mom and dad as I was, doing the examination of her spine. So all her neurological tests were fine, but then we get to the spine and, there are a few misalignments or subluxations lower down in the spine, nothing really to write home about until I get up to her cervical spine. And her occiput, so the back of the skull, the first bone and the second bone of the spine are just way out in left field. Mind the pun, but really in the wrong place. Super rotated. So that, to me, that's like a coat hook that I can feel on the side of her neck, as opposed to nice soft tissue that I should feel on the side of her neck. So I relate that to mom and dad. And I said, just so you know, the areas that I'm finding that are interfering with her neurology happen to be the nerves that go to control all the plumbing on that side of her head. So ear, nose, and throat, we all know those are connected, right? So I said, the expectation then is going to be, if I can make adjustment to those areas, which I definitely can, and we, remove that interference neurologically going on to the plumbing, I'm going to say the plumbing's going to get better. The tearing will probably resolve, the ears will probably drain better, and she's going to be better in no time. So they were very excited. I asked for permission. Can I do an adjustment right now? Let's just get this started, because she's clearly uncomfortable. And they said, absolutely, please. I explained a little bit there. We normally do most of the explanation at the following visit, but I really wanted to help this little girl right away. So we did the adjustments, and immediately, like right after I was done, she fell asleep out like a light. And that is actually a very common thing post-adjustment. So it really does drive the body, adjustments drive the body to go into more of a parasympathetic division, which is the rest and digest mode of the nervous system, as opposed to the sympathetic division, which would be like the fight or flight, harried, anxious, that kind of sort of side of the nervous system. So definitely the parasympathetics were stimulated as they should be. So she falls asleep. And then, I get the next day when I saw the family again for results and another adjustment. I mean, before they even said anything, she's in her car seat as they brought her in. And I could see like the eye is white, like the sclera is beautiful and nice and white. It's not really tearing. Her ear has maybe like 90% of all that crust is gone. There's not a lot of liquid going. It was like, I heard the angels. I was like, oh, because it's not a miracle. I know it's not a miracle. I believe in miracles. Don't get me wrong. I think they happen every day, but it's function. It just makes sense. So getting back to your comment, Jess, about how simple this is, that's how simple this is, right? It felt like there was restriction, blockage, interference, neurological distortion, however you want to look at that, in the nerves going to control plumbing on Olivia's left side. So on the ear, nose, and throat on the left side. And I was right about that. We corrected that. And here's what happens. Now the body can do exactly what it was designed to do, which is heal and thrive and function and be amazing, be the amazing thing that it's supposed to be. So that it was incredible. And it was so powerful. I had not, as I mentioned, I had not yet done the results yet with the family. And I mean, they're already telling me that they both are coming in to have their nervous system checked. That's a beautiful moment for me. And only because when you get it, you get it. And when the truth is expressed and you can share that incredible chiropractic story to people, that's my mission in this life on this planet. That's what I want to do. I want to get it out to more and more people because it's how we're going to heal the world. I know that. It's a big part of how we're going to be able to do that.
That's an amazing story. I find it amazing because it's like it's an ear infection, right? It's something that you wouldn't think would be related to the nervous system. And like you say, it's like your nervous system does everything. Everything is related to your nervous system. So it really just gets to the core. It's like in my line of work with nutrition, I'm always trying to like get to the core. And for me, it's like usually digestion, because that's the core of the food stuff. And for you, it's the nervous system, which is the core of what you do. So I love that story. We've been talking for a long time. We could talk for hours about this stuff. Can you just talk really, really briefly about your experience with Lyme? Only because it's on a lot of people's minds these days. It's just become a real problem. I know you had Lyme, and chiropractic was a big part of what you used to help you through that. Just really briefly, a rundown of the story, because it's another example. I mean, Lyme is a little bit more directly related to nervous system, but it's another one of those things that is like, when it's a mystery, and it's like, don't even try to solve the mystery. Just go back to the basics of the nervous system. Can you just talk a bit about that?
Absolutely, Jess, and you said that perfectly too, I gotta say. So very briefly, in 2011, I had a collection of very strange symptoms that would come and go, and a lot of them neurological, so electric shocks going down my arms, burning pain on my spine as if someone had like a blowtorch on my back. Like, it was just really weird, disconnection, like that feeling of a floating head. I've actually, patients have told me that before, and I never knew what that meant until I had Lyme disease and I experienced it for myself. The feeling that, perhaps I was having a stroke, as one half of my face would go a little numb just randomly, or would feel like it was about to be paralyzed, like I wouldn't be able to move. And the scariest neurological symptom I know I had was one day I was supposed to go and have a heart monitor put on me, just because I had a lot of cardiac symptoms as well with the Lyme. And the morning that we were supposed to go in, my amazing husband, he's getting me ready to go to this appointment, and I couldn't use my legs. So I remember I was sitting down, and he was telling me that, let's just go and have a quick shower, we'll freshen you up a little bit. And I'm giving the command. This was like an amazing moment for the nervous system for me personally, but I know I was giving the command. I was, above, down, inside out. That's how your body works. And I'm telling my brain is saying, okay, get up. Like, you use your legs and get up. And I couldn't. And that was really scary. That was one of the scary moments. And symptoms like that sort of went on and off, up and down in cycles for about a 16-month period with no diagnosis in sight. So a lot of scary differential diagnoses, all the while thinking, I just have to get through to the basics again. Like, you keep amazing, you say this so incredibly so many times, Jess, but you're right. And so it was like, some days I would get adjusted like 8 times. I'm not even joking. So really not holding on to my adjustments. But it's amazing when you're married to a chiropractor, how convenient that could be, that he's right there. So I'm so grateful that, he is who he is. My family is who they are, and my kids and everyone that was so supportive. But I mean, chiropractic saved my life during that time, because there were no solutions. There was only fear. There was only the unknown, and go to this neurologist and go to this infectious disease doctor and go to this other doctor. I was thrown around the system many, many times. And I have to tell you that I get this question a lot, would I ever go back and change it in time if I could, like not having Lyme disease? And the answer truthfully would be no, because it has made me much more empathetic. I have a lot of empathy before, but I got to tell you, I understand the plight of patients now in the medical system. I was on the other side of that relationship, and wow, is that humbling. And being told the things that I was told, like, you're just going to have to get used to this, like all the things I mentioned earlier. And it's not true. I just have to tell you, I've been there. And I don't expect that my experience is like all the other chronic experiences that are out there, because this did last for, a good 3 or 4 years. But I have to say that it's not the way that it has to be. And your nervous system is amazingly, and I'll use this word, plastic. It's adaptable. It can change. And if it changes, obviously for the better, then that means your body works better. You have better health status. And that's how I got through this. But once again, as much as chiropractic was a huge part of my recovery, Jess, it goes back to what you were talking about earlier about, having collaborative interventions. I really became a lot more in tune with exactly what was going into my body food-wise, the movement that I was going to be engaging in a lot more regularly, different types of movement, in fact, better sleep. So honoring myself and not staying up so late and not understanding those consequences, because I had done that for many, many years. So when I think back, I think when I contracted Lyme disease, I must have been at a really low point in my immune function, unbeknownst to me, right? I'm the chiropractor. Of course, that doesn't apply to me, but it did. I'm also a mom, and I'm also a female. So that puts me at risk for doing 25 more things than I should be doing every night and every day. And you can relate to this, Jess. And it was a great teacher. I will say this, and I'll always say it to the end of my life. It was amazing to be in that situation, because I saw the power of what I do, and I saw the power and the importance of incorporating all those other pieces to get myself well. Because what really did it, I'll just say this one last thing. Sorry, I hope that was brief enough, but I'll say this one last thing. The one emergency doctor, I was in the ER at one point, the first week of really acute symptoms, 4 times in 1 week. So with ambulances. I'd never been in an ambulance in my life, and that week I was in an ambulance 4 times. So I remember the 4th visit, they're getting tired of, Sabrina, the same staff is practically seeing me again, right? And I remember doctor came in dressed up like in a hazmat suit. Like, he was all covered up, he was all gloved up, because they thought I had some sort of infectious, I don't know what virus. And this is what he told me as I was sitting in the wheelchair, unable to use my legs. It was the same day as the heart monitor. And he goes, so you probably have a virus. You're just going to have to let it run its course. There's nothing more we can do for you, so please stop visiting the ER. And then he left, and I started to bawl, understandably. And then it was that aha moment, if you will, where I sat back and I'm like, oh my God, it's up to me. I better get this solved. I better go back to the basics. I better just make sure everything in my life is clean, from the thoughts to the food, to the sleep, to the movement, to more chiropractic if necessary. And that was necessary, it turns out, till we get this down. I got to get this down. And thanks to that, in large part, I mean, there were some homeopathic remedies I decided to use as well. I conquered it, you know, and I feel like after that experience, I can do anything. And I am so much better a doctor to my patients after having been through all of that. I understand them a lot better now, more than I thought I ever did before.
That is such an amazing story, and it's a great place to close off, because one of the reasons I thought of you immediately when I dreamt up this whole idea of the Resilient Family, a series of interviews, was because you have such a strong faith in the body and an understanding that, you know, what us, you know, we holistic people, our practitioners, say all the time, which is that the body knows what to do and knows how to heal and has an innate wisdom. But your belief in that, and educated belief in that, because it's what you see every day and it's what you've been working on your whole life, is so strong, and it's contagious, because I mean, people hopefully watching this can feel from you that you know so much is possible for each of us, because our bodies have this wisdom, and you have tools to offer us all, in order to, like, it's almost like you're the I don't know, road crew sweeping the way so that we can just do what we are meant to do, you know? And chiropractors in general, I have a much more of a respect for chiropractic after having spoken to you, because I understand that that's what you, as a profession, do. So I'm happy to leave it on that note. Is there anything else that you want to add in terms of, I'll put your contact information, as Dr. Saab and Dr. Jay, her husband, are both at the Live Well Family Health Center here in Ottawa in Nepean, and I'll put that contact information up. And she also mentioned some of the things to look for, some of the directories to look for if you're looking for a pediatric chiropractor. So I'll put those up as well. Is there anything else that you want to leave people with? A little something?
Yes, I do, Jess. I just want to say this, okay? Like, so no matter what your status is, no matter what the status of your children is, just know that when the body can do what it was designed to do, function and heal, and, you know what hormones to release and what muscles to contract, and when your heart should beat and when your lungs should inflate or deflate, everything is possible when that happens through clear nervous system, through clear brain-body connection, through wonderful nutrition, through moving the body every day. And as Jess said many times, just getting back to the basics. There is always hope. If I can just leave listeners and viewers with that, it's never the end. It's never time to settle for the state that you're in, ever. And I know I'm proof of that. And I see that every day, and I'm blessed too. Thank you so much.
That's awesome. I don't see any questions in the chat, so I guess we'll leave it at that. Don't do anything to your screen. I'm going to end the broadcast there. If you are watching this and you somehow don't get the links, and for some reason have a question or whatever, just email me and I will connect you with Dr. Saab or whoever you need to be connected with. So that would be at info@justsherman.com is my email address. And thank you so much, Dr. Saab, for being here. And thanks everyone for coming. Get back to your day. Take care.